Where we're at the moment, Fauzia, we are seeing internationally and nationally a big drop in the notified cases. We're starting to see drops in deaths from COVID as well. But it's not just those numbers. This is on a background of much of the world having immunity to COVID based on a combination of natural infection and vaccination. We've got well over 100 vaccines still in different phases of human development, clinical trials with human subjects. So we've got a lot of good news. So that's why the World Health Organization Director General said, look, this is like a marathon. We're coming to the end of it, but it is really important that we don't slow down, but we accelerate to the finish line. And there are two lessons to be learned from that. One, that the Director General of the World Health Organization hasn't seen me do long distance running, but also that you have to recognize that no pandemic doesn't mean no COVID. COVID will become endemic. It'll be less intrusive, but still part of our lives. So we need to transition to that properly.
But like your marathon running as well, there's a lot of training that's involved. We need to take some precautions as well, I guess. That's what the WHO is basically saying. Talk to us about what happens if we do slow down, because we have started to notice, pandemic fatigue setting in now, and people are starting to be a little bit more laissez-faire when it comes to their infection control. So what happens if we slow down now?
Well, I guess I might answer that by turning it around and saying what the World Health Organization has recommended. So what they've recommended, there's a series of policy briefs that have come out suggesting that it's really important we continue to focus on testing to find out if people do have COVID, to stop large outbreaks, but more importantly, to make sure there are no new variants or subvariants appearing. We need to make sure that our vaccination targets are up to date. And we need to make sure that we've streamlined the introduction of COVID treatments into general practice and hospitals. So if someone gets sick with COVID, we can treat them early on where they can get the maximal benefits. We have to make sure that healthcare facilities and nursing homes are protected in terms of infection control, because that's where our vulnerable populations are. Because if COVID flares up in those populations, we'll have a repeat of what's happened this winter in Australia, where we've had hospital systems overwhelmed and so many tragic deaths from COVID. And of course, we have to address the misinformation that is out there. That's going to be an ongoing struggle too.
There's always been a fear that the virus itself will mutate and therefore drag out this pandemic even longer. What is happening with the virus right now? We know we've seen several mutations of it, but what's it at? Is it slowly starting to deplete?
No, look, it's very hard to say, Fauzia. COVID has fooled us time and time again. We didn't think that it would mutate as quickly as it had. We didn't think we'd have something like Omicron with us so quickly. So, yes, it is something we have to keep in mind. And if a new subvariant of Omicron or a new variant appears, particularly during the Northern Hemisphere winter, then that will potentially set things back. So let's hope that doesn't occur. And, of course, because the borders to Australia are no longer closed, whatever happens up there will enter Australia without doubt.
I have to ask you about one of the symptoms of COVID, and I've had several friends and family experience this, and it's something that I quite can't really understand, and that is the brain fog issue. So when you do get COVID, there is this brain fog. You seem a little confused. You're a little bit slower. I think most of us can understand that COVID does affect the lungs, and therefore it affects your level of fatigue. Going up a stairs, flight of stairs would be very difficult. But what's actually happening with the brain fog?
Yes, so brain fog, Fauzia, is part of this larger spectrum of symptoms we're seeing with long COVID. In fact, over 200 different symptoms have been described. So it's a very protean manifestation of COVID. And we're still trying to learn what's happening. And I don't think it's any one thing. What autopsy studies have shown is that COVID is found all over the body, not just in the lungs, so in the brain as well. We've also found that a protein called amyloid, which is an abnormal protein you see in some other conditions like dementia, for instance, has been associated with COVID in the brain as well. And then there are a whole lot of other factors like interferon levels. It's a molecule that our body uses in its immune system that can be high in long COVID. There may be more microclots. So it's this conglomeration of various factors, and we have to try and work out which ones we treat and how we treat them.